I would get the pads. I would check the machine for any abnormalities, any wiring. Make sure it's plugged into the wall, no cracking in the wires. The screen's not cracked. I would make sure that the pads aren't even broken. Make sure they're all fine. I would ask the patient if they had history of E-stim before. I would make sure the contraindication, like there's no rashes, no bumps on the skin. I would also do light touch perception. I would do capillary refill on the toes. Then I would take their pulse, put them in a comfortable position. Are you in a comfortable position?
Yep.
Comfortable position. I expose the treatment area, which I'm doing the quads. Let's make sure quads. I'm going to turn on the machine. Okay, turn on the machine. I'm going to select electrical therapy. Do IFC. Then I'm going to place the pads in the pain area. And if it was closer to their private area, I could use a towel to cover it up if they felt uncomfortable, stuff like that. And I would make sure that the pads are sticking adhesive. The negative goes down, positive goes up, and these like crisscross. That's channel 2. I would set the time. I'll leave it at 20 minutes. Tell me when you feel something. I would adjust the intensity. Tell me when you feel something.
Now I feel something.
And tell me when it's intense but not painful.
That's good.
Okay. Then I would make sure that the pads are still sticking to the area and surface area. I'm gonna hit start. Then I'm gonna hit the home button for other ATs to use. Then I'm gonna monitor the patient during the treatment time, make sure everything is going okay.
Everything's good.
It's going okay. Then after a while, I'm gonna zero out the machine. you're at the machine, hit stop. Clear. I'm gonna ask the patient how the treatment feel.
Good.
Then when the pads are off, I'm gonna check to see if there was any adhesive after treatment, any like rashes. Then I'm gonna clean up, put everything away, put the pads away. Then I'm gonna ask if there's any questions for the patients. No?
No questions.
Okay, and then I'm gonna turn off machine.